life surgery course I never done before. This is my first one.
We're looking, how do we get more experience?
I really wanted to solidify the fundamental.
Some experience, but wanted to improve.
I have heard a lot of good things about the Bice Institute.
And I have done 5, 6 different life surgeries before. I have to say this is the most organized program, life surgery.
I place most of my implants guided, and then I don't do as many. Sometimes I'll do a few more, and then sometimes it goes a month or so without placing any, so it's on and off, on and off. So it's, you kind of do some things and you wish you can change it, but then you don't do implants for a few days, few months. It's you kind of forget what you miss.
We got it. First case. First menu, full arch. The upper full arch. And the sinus, bilateral sinus lifting. Yeah. Yeah. We'll start with something simple.
I'm going to operate, please.
Oh, we have a Dr. Brian, Dr. Dennis right there, okay? Dennis? Yeah, there you go. Don't they look very confident? Don't they look awesome?
That's right. That space is only 5 millimeters. It doesn't make sense.
Can you do the maybe 1/6 instead?
Hi. Okay, so the game plan, the original treatment plan was to put an implant in this space here. But the space is only 5 millimeters. It's too small. It doesn't make sense.
Yes.
If he's okay with it, implant here and here.
Okay. Yeah. Thank you.
Yeah.
Vamos a trabajar del lado izquierdo.
So our original treatment plan was to do a SA3 on tooth number 1/6 after multiple extractions, placed in 2 implants. But this will change. This might turn into an immediate molar. So we'll see what happens.
What are you doing now?
We are coordinating the patient so that everybody has a case to work onto.
Looks real organized.
Oh,
Right?
I'm trying my best. Trying my best. Try to see what they need and report it as they need to. What are we doing for you?
It's okay. But we'll see if 7 works.
Keep my patient alive, okay?
Plunge.
Okay. Awesome. Yeah. There's only 2 machines.
Let's sleep. Is there one more?
There's only they're supposed to get another one.
We're gonna make a medical touch now.
Okay.
Hold it in, right?
Anyone?
Anyone? Okay.
4x10?
Yeah.
So I want you to go around, get a feel for the vibration. Okay. Keep the window. Okay, about 7x10. Okay. Yeah. All right. Wow! Mamma mia! I'm gonna go.
So bad. So first time on your own.
Everybody, cheers for Vice Institute, live Mexico, TJ. Yay! Awesome, awesome. Cheers, 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 cheers.
So what are you doing now?
I am organizing tomorrow's schedule because things always change. And to double check
Dr. Scott Jung. I was actually friends with him back when he was living in Alberta. We were both recent graduates, and then he moved to BC, and I didn't see him for a while. And then the next time I saw him, he was like an implant expert, right? And I'm not. So I said, what happened? So he said, Bites Institute.
We're talking about this immediate implant case that we are planning for tomorrow morning.
It's still very close.
You guys haven't tried to immediate case in your clinic?
Yeah, I do a lot of immediates. Actually, most of my implants are immediate. Yeah.
I've done an immediate today.
Few more tomorrow.
Few more tomorrow.
Yeah, so
This is the Ryan's case?
No,
This is going to be a
this is
Kapil's
really?
case. Yeah.
My case.
Oh.
He's planning it, I'm watching it.
9:30, and we're working on cases right here.
The environment here is the most intense learning experience that I've seen from any of the other life surgery groups. Everybody here is willing to teach, and the students are willing to learn.
It's gonna take me longer than that time. Sometimes I'll just wait until I'm done and take out
Actually, for nurse, that's the only surgical verb. They've asked too, there's no other surgical verb. See, he showered too.
Did you shower?
Of course. Yeah. See, we said like 15 minutes is plenty of time to shower.
You should have said
15 minutes. When I say 5 minutes, no shower. 15 minutes, shower. And change to short.
I need about 15 minutes shower.
Get with the program, man. Huh? Man. You dress just like my 8-year-old daughter. You know, tank top and shorts. So cute.
It's comfortable.
The hotel is really good. I like the hotel, right? Because that makes a difference in my mood, right? It's modern, it's clean. The shower water pressure is awesome.
Okay, yeah. So tomorrow you got bilateral sinus on you. Right. Okay, Brian? And we're gonna do 6 on those. Okay?
It's not just placing the implants, but kind of having a direction on where to place it, right? So it's placing an implant isn't as hard. It's more like the comfort level of having like the racial mentors to you, where they can tell you before you kind of commit to something whether or not you're in the right position.
I don't think it's a good idea to do your first lateral window sinus lift without supervision. You don't know how far you have to lift it. You don't know what if you tear, what are you going to do, right? You haven't been there before, so.
You're doing good, okay?
Oh, Jesus, David. He's not leaving me alone, man. I don't know what's going on with this guy. He likes me.
Good. This is an acting workshop too. They didn't tell us. So.
It was a great case. It was something I'd never seen before, only heard. Yeah. We're in the good hands of Dr. Ahmed. We're learning a lot, so that was a great case.
Dream team. Dream team.
No. We're the dream team. We're the dream team.
Please steal it. Please steal it.
You know what? Honestly, I came with no expectations. I just came to like an open sort of mind, right? But I was hoping, no expectation, but I was hoping to learn something I didn't know. And I can tell you that I've seen a lot in the last couple of days. Obviously, there's really no ceiling to learning.
This is intense. We're doing, full arch implant therapy for patients. We're not only extracting teeth, we're lifting sinuses, we're rebuilding bone.
Dr. Kwan doesn't really set a limit on like how much he's going to teach you. Like, he'll teach you everything that he knows. If you want to like put in the work, then like there's no limit.
It's so systematic. Start from treatment planning to execution. I know what we are doing and how, and then I feel confident in it.
You know what you're doing next day, and then there's no delay in the surgeries. The patients are happy.
I highly recommend people, even if you don't go through Bites Institute, the Institute just tries to teach you the fundamentals. It's at the end of the day, it doesn't matter how complex the surgery is. It's all the same basics and approach to surgery.
I love Bites.